Good afternoon, guys. I've got discussion A for you. Today, we are discussing stem cell use in rheumatoid arthritis treatments. So we'll dig into that for this afternoon's topic A. Here we go. Consult a qualified clinician before considering stem cell treatments. The page emphasizes that stem cell approaches for joint disease are still investigational and not established standard care yet. Main message on the page. The article presents stem cell therapy for arthritis and joint degeneration as a promising but unproven option. It highlights specific interests and early positive reports while repeatedly warning that treatments remain experimental, unevenly regulated, and not FDA approved for most forms of arthritis. How the page describes the proposed benefits: regeneration and pain relief. The page explains the appeal of using adult or mesosynthesized stem cell to regulate cartilage and reduce pain. It notes researchers, including work at major centers, are exploring these possibilities. Immune and anti-inflammatory effects. It states stem cells may produce anti-inflammatory signals and support tissue repair, which is why patients and clinicians promote them for osteoarthritis and related conditions. What the page says about the evidence and limits. Early mixed research. The article cites small trials and literature surveys showing potential symptom improvement. Some studies report substantial pain reductions, but it stresses results vary, and high quality, large randomized trials are lacking. Heterogeneity of methods, differences in cell source, preparation, dosing, and follow-up make comparison difficult and prevent firm conclusions about effectiveness. Risks, disadvantages, and regulatory cautions highlighted. Safety concerns. The page lists infection, bleeding, adverse cell reactions, and theoretical long-term risks, including cancer risk and possible worsening of inflammation as reasons for caution. Cost and exploitation. It warns many private clinics charge high fees for unproven treatments, sometimes operating outside FDA oversight, and that patients can be exploited by aggressive marketing. Practical guidance the page recommends for patients: verified trial and regulatory status, prefer FDA authorized clinical trials or IRB approved studies. Rather than commercial, unregulated clinics. Check eligibility and screening. The page lists common exclusions: active cancer, blood disorders, infections, and, and stresses, individualized evaluation by a qualified physician. Ask about manufacturing and follow-up. Confirm donor screening. CGMP processing, batch testing, and long-term monitoring. Before enrolling, balanced summary and what this means for someone reading the page. Promise, not proof. Stem cell therapy is presented as scientifically interesting with some encouraging early results, but the page's dominant theme is caution. Benefits are not yet proven for routine treatment of osteoarthritis or other joint degeneration, and safety quality vary widely across providers. Okay, consult a qualified clinician before considering stem cell treatments. The page emphasizes these approaches are investigational and not standard care. Core message of the page: the article presents stem cell therapy for arthritis and joint degeneration as promising but unproven. It highlights specific interests, early positive reports, and media clinic promotion, while repeatedly warning that most treatments remain experimental, unevenly regarded, unevenly regulated and not FDA approved for routine arthritis care. How how the page says stem cells are supported to help regeneration. Stem cells, especially mesenchymal adults, stem cells are described as able to support cartilage and joint tissue repair, which is why researchers and some clinicians promote them for osteoarthritis and joint degeneration. Anti-inflammatory and immune effects. The page explains stem cells may produce anti-inflammatory signals and modulate immune responses, potentially reducing pain and swelling in affected joints. What the page reports about the evidence and duration claims. Early mixed research. The article cites small trials, literature, surveys, and institutional interests, but stresses that study methods, cell sources, dosing, and follow up vary widely, making results hard to compare. Duration claims are variable. The page quotes typical effects, windows of 6 to 24 months for orthopedic conditions, and notes some reports of benefits lasting several years, while also saying long-term high quality evidence is lacking. Professional guidance. Major bodies like the American College of Rheumatology and Arthritis Foundation are cited as not endorsing stem cell treatments for knee OA because evidence is insufficient. Risks and harms and potential cautions emphasized on the page. Safety risks, infection, bleeding, adverse cell reaction, and theoretical long-term concerns. Including cancer risk or worsening inflammation are listed as reasons for caution. Regulatory and ethical concerns. The page warns many private clinics charge high fees for unproven, unregulated treatments, and that companies sometimes market stem cells for conditions they are not approved to treat. Who the page says is not a candidate and what to check before enrolling. Common exclusions: active cancer, blood disorders, severe anemia, active infections, and other serious conditions are listed as typically disqualifiers. Practical checks: verify whether the treatment is part of an FDA authorized clinical trial or IRB approved study. Ask about donor screening, CGMP processing, batch testing, published peer-reviewed results, and long-term follow-up plans. Stem cell therapy for arthritis is scientifically interesting and may relieve symptoms for some patients, but it remains experimental. Safety, effectiveness, and long-term outcomes are yet proven, and patients should prefer regulated clinical trials and specialist guidance over commercial clinic marketing. Okay, guys, that's your A for this afternoon. I'll be back on with B shortly. Give me a bit to put that together, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.